ribbon cutting we did yesterday or what, but I'm like in zombie mode. So first of all, happy Friday. Good morning to everybody. Um, I see a lot of NOAA folks on this call. Is anybody, who else is on? Hey, Jerry, good morning.
I'm on.
Awesome.
Hello, how are you?
Good, how are you?
Good.
Good morning, this is Brooke.
Hey, Brooke, good morning.
Good morning.
So, we are trying to look for the, Danelle, do you have the
agenda?
Yes, please.
Yes, I do. Let me pull that up.
Awesome. Perfect. So there's just a couple of things we wanted to kind of talk about today. I was doing some mental and research on the computer in the last week or two. We all know holidays are here and we've got holiday fun stuff going on, but I wanted to talk because I'm a planner and I wanted to talk about what we're doing for next year, in particular, the first 3 to 6 months. And if there's any, oh my God, that's so cute, Jerry, your cat. Is that hashtag?
That's hashtag everyone.
Oh, awesome.
Oh, so cute.
Yeah. Just kind of wanted to get an idea of what everybody is doing with regards to marketing campaigns for the first half of the year. And then I kind of wanted to talk also about sort of employee swag. Does anybody have like a swag store? Do they have anybody that kind of manages that? What does it look like? Are they getting good feedback from it? Do the staff love it? Because during the open house, even yesterday, I had some folks say, oh, including myself, I really want that NOAA jacket, or I really want that NOAA shirt in the gray. It's I mean, I said that like 5 times. And so I wanted to see what folks are doing, how they're having their staff order, or do they place the orders in how does staff pay, or is it complimentary, part of the job, things of that nature. So let's go ahead and get that going. Let's start off first, of course, with any marketing campaigns that folks are doing for the first part of the year, and kind of what are they?
So it looks like the only health centers on the line are NOAA and El Rio. So you all can share with each other about what you're doing.
And this is Nathan from El Rio. Go ahead.
Nathan, I want to, let's go, since it's just the two of us, can we just go off script and go back to your website discussion? Because Carly, who's on this call as well, we're actually looking to revamp really the UI, not the structure of our website too, and seeing where the most kind of traffic goes. And I just want to pick your brain for just a second, because our analytics are showing, you made a very great point. There's the difference between causation and correlation and how people navigate website. Is it because we set it up that way that it's doing that way, or is it because they really have sought that out, right? And so we've been in conversation a little bit too with Yext. I don't know if you guys use Yext for your directory listings or any of your search. Do you guys?
No. We and like I said, we, it's been kind of all kind of integrated, and that's where, I mean, I'll be honest with you, when our site was done, probably now it's been 8-9 years ago. I mean, strictly a brochure site, right? Click to call. I mean, we have analytics and stuff. Like I said, we didn't party with, we don't have any third-party vendors on there helping out with anything like that. So it's all kind of manually done in-house, like provider listings and all that good stuff.
And we are too. Like right now, that's where we're at as well, and doing everything. And I was just wondering, like, our traffic primarily comes in and they are either searching for locations or providers, right? They just want to look up providers, which is not shocking
Right.
in any way. But we were also investigating a little bit more kind of chatbot and looking to see if we could build out kind of an AI with those frequently asked questions type of thing. Were you guys thinking of investigating into that idea where it might not be an actual like live person because we're coming down a problem with staffing, something like that, but more of like that AI technology that learned question.
Yeah, the
Have you guys?
adaptive. Yeah,
Yeah.
and you bring up a good point because we did launch probably about a year and a half ago. We launched live chat, so we do have a live chat option when people are on our website during our patient communication hours, and I know that's all housed with numbers and stuff in our patient communications area. So I don't have analytics on that as far as how much it's used, but I know it wasn't a medical field, but in the financial industry. So before I came to El Rio, I worked at Tucson Federal Credit Union, and we did implement. I can't remember the software, but we did implement that kind of adaptive learning where someone asks a question, and it searches the database or knowledge base really quick, and then auto populates. But then it also learns where it says, okay, well 12 people this month have hit this keyword, so maybe you think you need to think about creating a script around that in your database or knowledge base around that particular question. So when that keyword's put in a search or a chat, then you can auto populate. So, and like I said, that was probably 5 years ago before I came to El Rio, so I'm sure it's gotten even more advanced. But I would love to do something like that with El Rio, just because to your point, right? Top hits, locations, providers, and then like services, right? Is like two or three. It usually fluctuates between that and careers and things like that. But we have a lot of people that just call us to hear what our hours are. So we tried to look at what were people calling in about, and then we also put that on our on hold messaging, so then that way then the call tree, it could be addressed before they even get it connected to a live person. But right now we don't have anything where the adaptive like knowledge based learning in chat. We just have live chat. But like I said, I looked at that option 5 years ago, the last place I worked, and I know it was awesome because you literally could try to get it fully automated to where you would never have to actually get a live person from your patient communications, pending the type of question, of course.
Yeah, and that native language adapter is something that is intriguing to me because the way that people ask questions is completely different, right? So the
Right.
taxonomy that we think of like, oh, well, we're asking for this, and then we're not returning the right result, and then we're causing almost I don't know if it's even a worse patient experience, but it's at least more frustrating up front. So we've looked at a few. Some are really basic that are affordable, and then there's others that are like, yeah, that's out of our
Right. Yeah, and
that
like I said, it's been
that
years since I've looked into it, but I think future state for our El Rio site, if you find a good vendor or a good solution, like I'd love to hear about it, because I think that's where we'd like to get, right? Is you're paying this much money to host or to have a website and create a website. It needs to function as more of a tool versus taking time away from your patient communication staff on the phones, or answering live chats about what are your hours, or are you open today. We get like just crazy stuff that you wouldn't believe that people use live chat for. So
yeah, and that was one of our big concerns of our patient engagement center, our call center. They were like, well, we don't want our call centers people to be answering medical questions because people are going to be asking that constantly, and it's like, well, I get that we can't stop them from asking that question. I was hoping to do some sort of integration that goes even beyond that, that's taking whatever those questions are and seeing if we can almost do this self-service of being able to like do some tagging and be able to mark them within an Encompass CRM that could then say that we had so many people searching on diabetes, as an example. Now knowing that would be kind of the content that we need to start presenting more on to those MAC addresses, and sending it back to them. I think that would be the coolest thing, to be able to start really aligning targeting
Right.
as part of that education piece and that retention piece for our patients. Not necessarily on the acquisition, but on that retention part of our jobs.
Yeah, no, that would be great. Yeah, if we had, because we switched over to my chart, or what was it? Sorry, not my chart. I got my chart on the brain, but we switched over to Epic last November. We're still trying to research, but yeah, it would be fantastic. To your point, if a patient went to our website, and was able to identify themselves, obviously, and had questions about that, then we could, put some extra, collateral items, or, something around, to your point, diabetes or something in their my chart, and see if they'd like to schedule an appointment to talk about diabetes, or, just like you said, to identify, our patients and maybe what they're struggling with, or what they might be interested in too, around health and wellness and things like that, and be able to further target them. That would be fantastic.
All right, Nathan, now you brought up a whole other can of worms I got to ask you about, and I know Brooke's going to want to know a little bit more about. So we're moving to Ochin in our own instance of Epic, as a way from, our story. We're kind of tied into the hospital one of Honor Health, but May 9th is our go live for Epic and our own MyChart.
Okay.
And are you all doing open scheduling right now on your website?
No. So they've got to be, we've done like the tethered login, to where once they go into my chart, and then they can schedule once they're within my chart. So I guess in a way, I mean, open scheduling, as far as once they log in, they can get appointments.
No, open. No, I'm thinking more open scheduling, like
right.
They're a brand new patient.
Yeah. Unfortunately, no, we haven't been able to get to that point yet, and a lot of it is just because of, we've got, like, I'm sure everybody on the call today, like, provider shortages and issues with staffing, and just trying. I mean, Rio, unfortunately, since I've been here the last almost 5 years, we've had a wait list of patients. So, it's a good problem to have, right? But also, to your point, what's that? If somebody wants to come to El Rio and then they can't get in for 3 months, they're going to go elsewhere.
Yeah, absolutely.
So
yeah, how do you? So, all right, man. I know I've just completely hijacked the conversation from you all, and I apologize that I'm doing this. But man, I now want to know, how are you dealing on a patient experience side? You're telling me you all have a waiting list of patients trying to get in. How do you manage that communication and that patient experience, like when somebody new is trying to come to you? I mean, I gotta tell you, we have so many new patient requests that are coming to us, and then trying to like say, hey, in 3 weeks, 4 weeks, sometimes months, depending on what the service line is. Like, we have a difficult time with that. How do you deal with that if it's just on primary care and you guys have a wait list?
Yeah, and being a one-person team over here, it doesn't usually trickle down directly to me, as far as, other than managing, Google reviews and things like that. But that's definitely something I can kick towards, like, our patient communications manager, and just see, like, how do those conversations go? Are people upset? But obviously it's not ideal, and it's something we've, as an organization, struggled with, at least since I've been here. And so I don't even, to be honest with you, what the current wait list is with, I know certain patients, obviously we have to get them in, by a certain time to make sure that we're meeting our obligations. But, general population, yeah, I'm embarrassed to almost say it, but it, it doesn't necessarily come across my desk as far as like, oh, we've had, 35 patients want to sign up, and, 25 of them were pushed 2 months out, and, we got these like hate messages, or like, so it's one of those things I've been shielded from, but it's good and it's bad that I'm shielded from it, right? Because, other than what our reputation is out there based on reviews and whatnot, that's kind of the only connection I have with how good or bad that process, or that discussion goes.
Hi, can I ask a question? This is Brooke.
Sure.
Can you hear me?
Can.
Go for it.
Okay, sorry. No, it's okay. I was just wondering. So when you guys are talking about wait lists, do you have the capability, Nathan, with my charts where patients can request, maybe if they have to make an appointment 3 months out, they can get put on a wait list and they'll get notified, like we had a cancellation today or tomorrow, and you can set limits with, you have 3 hours to respond and then it goes to the next person on the list. Do you have that enabled with my chart with your organization?
I'm embarrassed to say it. I don't know if we do or not. That's more of kind of an operations thing, but I can find out.
Okay, I'm just wondering if that's even an option with Epic Ocean. I know it is an option with my charts. It has to be turned on, and I'm sure it costs a little extra money, but it is a patient satisfier. If whoever's next in line, it kind of goes through those patients who are waiting to get in when there are cancellations. And I don't know about you guys, but we do have a higher percentage than we would like for patient no-shows or cancellations every day.
Yeah, exactly. Well, and I would think just from efficiency standpoint, right? Your providers and your staff are already there. What's the next best option to try to fill those potential time gaps? So let me find out, and this is Brooke.
Yes, yeah, with
Okay,
Noah,
perfect.
patient experience.
Okay, perfect. Let me find out what our process is, and I can definitely get back to you.
Thank you.
Yeah.
Or any other ideas that you guys have that you're addressing this. I know, for example, at one of our locations, one provider in particular had 9 no-shows in one day. That's
Wow.
a significant loss, right, to time management, but also patient engagement and money in our pocket as well.
Yeah. Well, and then we always have a little bit for same day as well. So I don't know maybe if those get filled with same day or how that works, but I'll find out for sure.
Okay, that would be great. Thanks.
Oh, hi, Janie. You jumped into our conversation that was just like between Noah and El Rio. I think, you want to.
Good morning. No, I'm listening to everything.
We figure we're we don't have a lot of participants, and we have a good contingent from Noah on the call. If anybody, I do want to say, if anybody from Noah wants to drop off, they're welcome to. I know Tiffany, I can kind of handle any of that. You're welcome to stay on as well if you just want to continue to learn a little bit more. Sorry to hijack that from you, Tiffany. I had questions for Nathan. I'll be better.
And Michael, hey, I extend it. If you ever want to jump on a call, I'm more than happy to, share at least what I know and struggles and wins and anything that you might help you guys or help you.
Yeah, I'd love that. In fact, I was thinking about the last time I missed the last COMET meeting, but I was hoping to kind of touch base with you a little bit and kind of bounce some other ideas off of you, knowing that you all just went through your Epic transition and what you've been going through with that on that experience. And I'd love to get a little bit more about what you're looking at from the website and the digital side, because we're planning things, but we haven't done anything yet. And if there's missteps that we can avoid and that you've done or vice versa, I'd love to share those with you. Just because we don't know what we don't know. Right.
Perfect. Well, I will, you know what I'll do? I'll follow up after this call. I'll just shoot you an email. So, and then we'll, like I said, maybe try to find a time next week just to touch base.
That'd be great.
Perfect.
I mean, just don't do Thursday or Friday. I'm going to be eating turkey.
Yeah, exactly. Yeah, you and I both. So yeah.
Congratulations to everyone at NOAA. I know you had the opening of your new clinic.
We did. I would love to say that it's actually open, but construction delays. We had a ribbon cutting, and we cut that ribbon. We're still hoping for first patient data December 5th. So I was just coming back from there this morning and then hoping. I think all of us who have been through the last couple of years in construction and new facilities know what nerve-wracking that is. And seen every blemish, go through it, is one of those things that I'm just ready for it to be open and be done with at this point. I know that sounds like a maybe defeatist mentality, but I'm hoping that we can start seeing patients as soon as possible here with that. Yeah, but we are excited about that one. Biggest location yet today. To redid a car dealership into a clinic has created some interesting challenges and some fun and some not so fun. And so we're looking forward to that. And now almost our entire team is like, okay, that's pretty much done. We're almost on to the next project, right? Like that's all of us and what we do at community health. So, we had on the plans, and since it's just really a few of us, I wanted to maybe we have a couple agenda items, but wanted to see, like, are there any big campaigns that are different than our normal stuff that you guys see that are coming up, or foreseeing how that's going to look in 2023, different than our standard? And I don't mean to say that, but I say that there's always standard seasonalities, right? We do the awareness months, we do the flu seasons and stuff like that. I'm not talking about those. We're all going to do those. Are there any like different kind of campaigns that you're looking at to focus on that you have never done before, as part of a patient communication driver, to either increase kind of quality metrics or acquisition or retention for our patients? And then separate from that, thinking that that's our external, are there anything internal that you all are doing? I wasn't part of the conversation last week, but it did sound like we mentioned we do some internal type of communication with our internal newsletters and beats and things like that. Do you guys have anything kind of planned for 2023 and what you're looking at for the upcoming year, or is it too early still? I mean, I don't want to assume it's too early, but it might be.
The big thing we're looking at is that now we just got a little more breathing room, but the end of the public health emergency means a lot of folks potentially getting kicked off of access. And so obviously that's something we don't want. And so we've started conversations of we don't want to kind of blow the whistle too early on that. But then we also know that when it actually happens, we want to be as ready as possible to support our patients in doing what they need to do to make sure that their addresses are updated, that they have the correct information so that they can do the renewal forms as needed. So hopefully not getting kicked off.
So Janie, yeah, we're in the same boat with that. We've created a bunch of different assets that we haven't actually released yet in kind of a campaign. We're kind of worried that we're not going to get out the message as strong as we need to with that. We just produced a video that we haven't obviously released yet. And we have some ideas for some landing pages to go, but as of right now, we're doing very passive stuff. Like, remember to go to access and make sure your information's updated and all that stuff, which I don't know if that really means anything to people in some cases. So
that's kind of what we're doing. I mean, that's the same that we're doing. And then just what we're hearing is that when people do call access, they're on hold for several hours. So my community partnership specialist actually just got trained to be able to do the eligibility stuff, just to have a few more hands in that area to help. So we're just kind of figuring out that once it actually does happen, access, if they're overwhelmed right now, they're going to be even more overwhelmed. So trying to figure out what we can do to avoid them getting all those calls when it does happen.
Well, that's interesting. I'm going to ask our director of community equity is oversees that community resource and the application assistance program. And so I'm going to reach out to her to see if they have anybody in-house trained, because you're absolutely right. Like, if they're overwhelmed now, God, just wait. access. So you all can basically help your patients up front to make sure that it's all correct on the access side. That's kind of what they went through the training.
Yeah, so far, I mean, so far nobody on my team, but our eligibility staff can help just kind of make sure things look good and that they won't have to spend hours on hold.
Yeah, so then are you asking them, so when your communication out, like on a public level, are you still pushing them to go to access? Or are you now saying connect with us, like connect with, you know, Mountain Park to?
Right now we're just saying, make sure your information is updated and let us know if your information isn't updated, and then our team goes in and updates it.
Okay.
Yeah.
So you're not telling them go to access to make sure it's updated. You're saying come to us.
Yeah.
I like that better.
Yeah.
Okay. Okay. What do you have any big plans? Like once the actual, you know, once we actually start this rollout of the phasing out, do you have kind of communication prepped of how that's gonna roll, or no? You're just gonna.
Yeah, we had some stuff prepped when we thought it was around the corner, and I actually just made a note to myself to like, hey, let's just have that ready to pull out, because sometimes things get so far in the distance that we just don't even know how to find it. So, but we did have, you know, we had some boards for the front of one foot in our check-in desk areas of like, make sure we have your updated address. You know, we want to make sure that you're not that you don't lose your eligibility services, that you don't become ineligible for these services. We want all of that. So, but yeah, we haven't made it sound as scary as it is. I mean, the truth is, and I was on a national call and they were talking about just the numbers of folks that potentially could get kicked off. Let me see if I can pull that up. But for Arizona, it was quite a bunch. And knowing that us as community health centers, that's a good chunk of our patient population. And so just doing anything we can to hopefully avoid that.
Yeah, us too. And it's funny because like, yeah, we developed a lot of our assets really quickly right for this summer, and we got to pull it back up because I'm almost concerned that maybe we might even have to change the messaging of how that flows now. So, yeah, so that is definitely an interesting thing. Hi, Claudia. Thanks for joining us.
Hello.
I saw a note that you're going to maybe chat with us right now about open enrollment.
Yeah, definitely. Well, thank you so much for letting me join your call today. Yes, we are in a busy time right now with open enrollment for the marketplace, and just kind of wanted to chat with you all a little bit about you know, some of the things that we're doing within the Navigator project, but also sharing out with everyone, and kind of discuss with you all how you all are kind of working in that space right now. So am I allowed to share, Dana?
Let me make sure. Sorry, Claudia. You should be able to. Yep, you should be all set.
Okay. So I just prepared just a few slides, you know, nothing too long. So slideshow. Oh, how do I switch this? Oh, here. There we go. All right. This over. Okay. So obviously we're in open enrollment, and if you can believe it's the 10th one. I cannot believe that's what's been happening for basically 10 years now. So here we are, and basically just wanted to chat with all of you with kind of how you're all getting the word out about this. I know you talked about the unwinding of the PHE and marketplace, and all of these programs are going to be kind of obviously working with all each other as we get closer to the unwinding of the PHE. But for now, obviously we're heavily focused on, you know, making sure that open enrollment, that people know that open enrollment is here. So it's from November 1st to January 15th. So our communities have about 10 weeks to enroll into health insurance coverage for 2023. And the one thing I always stress with people when you're doing any kind of marketing, that one of the first major deadlines that we have with the marketplace is that if consumers want their coverage to start, you know, right on January 1st, you know, because they want to start that year off, you know, with that coverage in place, they really need to select a plan and pay their first premium by December 15th. So you will see a lot more messaging as we get closer to that date, not only from healthcare.gov, but from CMS and other partners, that, you know, if you want your coverage to start on the 1st, make sure you select a plan and pay that first premium. So that's one of the major messaging points that we have for everybody during the marketplace open enrollment. And what I wanted to share with you all, because I know sometimes we don't realize like all of the toolkits and resources that are available for outreach. Here are some resources. I am a firm believer in not having to recreate the wheel, you know, because everybody's so busy sometimes. And so you have some links here to some of the resources that we share out within outreach and enrollment, and also our grant partners. So we have some toolkits here from CMS, out to enroll. Some of them are more population specific, Young Invincibles and Children's Action Alliance. A lot of these, the Children's Action Alliance toolkit, that one focuses, they do have a lot more messaging related to the PHE unwinding. And I know you were I jumped on and you were talking about that, but they have some really good materials that you can all adopt if you so choose, that is kind of related to the PHE unwinding. And these are just some of the samples that they have. I love some of these visuals that they have, you know, like don't leave it to chance. You know, healthcare is really important. And, you know, here accidents happen, making sure you're covered. So I think some of these messages that they have can really resonate with our communities. And some of the materials they do have are translated in other languages. So obviously being conscious of that aspect of, you know, when you're doing your messaging. So I want to make sure I will share these with Danelle, these slides with Danelle, and then Danelle, you can just go ahead and shoot them out to everyone, and you guys can all, you know, see them or use them as you see fit. Let's see the next slide. Just from a marketing standpoint, within our Navigator grant, we the sub-grantees, which some of you on the call, you are working with us on Navigator. You all have your own like strategic plan that you put together for marketing and things that you want to do for open enrollment. But just as a whole, the Alliance also takes a much broader scope with marketing through Cover Arizona and that whole coalition. So we, during the marketplace, also heavily market the 1-800 number for Cover Arizona. So if your health center is in the connector, which is part of the Cover Arizona coalition, you may see an increase in calls. Because we have the 211 crew is currently answering this 1-800 number, and they go into the Cover AZ site. They can look up sites by zip code, and if your health center is in there and somebody needs to make an appointment for marketplace coverage or potentially access or kids care coverage, they're going to send them to you. So we always encourage everyone to have some visibility in the Cover AZ site, because it can send potential consumers that may become patients of your health centers. And so this is some of the marketing that we do. This particular ad that we did for this current open enrollment, we teamed up with Mari Ravago, who is a very well-known media personality in the Hispanic population. And hopefully this plays. It's a very quick ad. So hopefully this plays.
I don't think we can hear the audio, Claudia.
Oh, you can't hear?
No.
Oh, darn. Okay.
But we're going to send it out. So
Okay.
Claudia, just to let you know, when you share your screen, there's a little toggle on Teams that says you must share computer audio if you're going to play a video.
Oh, okay.
It's
Thank
different
you.
than Zoom. Yeah.
Thank you. We'll be sure to send this out, but it was a very quick 15-second ad. Actually, this one, because Mari focuses on the Spanish speaking community, this is a Spanish speaking ad. And it's just an example of one of the things that we do marketing wise for the whole state of Arizona, letting them know about Cover Arizona during the open enrollment period. Some of the other strategies that we're also employing for open enrollment, just so that you all are aware, we're also working with Cox Media, and they are doing more digital advertising and banner ads for Cover Arizona. And again, this is for the entire state. We're trying to reach as many people as possible. And one of the other things, we're also working with Children's Action Alliance, and they also do some ads in some of the some of the tribal radio stations for those communities. And so, you know, we have a kind of our larger marketing strategy that we're doing in open enrollment, but then also the partners have their own strategies that they're employing, because of course, our communities, they like to digest information in certain ways, right? So just kind of being mindful of that. Oh, sorry, I was trying to play again. And so I guess in this discussion that I would like to have with all of you is how I'm just also curious, how do you reach out to your community during open enrollment? I talked about, you know, radio, newspaper, there's television. Obviously there's community events where you can have marketing representatives out there. Some of you, I know some health centers are doing like geofencing. So it's fine. You're like, I myself had never heard of geofencing. And then I found out what it was. And it's really interesting how you can be tracked across sites and be targeted for certain ads and certain services. So I guess for me, it's just kind of a discussion point with you all. How are you doing marketing or any kind of efforts related to open enrollment at this time?
Hi, it's Nathan with Rio. I can kind of jump in here real quick. So, you know, now that we're back, well, I want to say post-COVID, right? I mean, COVID's still out there, but there's actually community events, at least down here in Tucson. We've had, you know, now that the weather's cooled off, and you know, there's a big one coming up tomorrow that we're doing with AZ Bilingual. So handing out a lot of collateral materials. I mean, obviously, all those events are done by our eligibility department. That's also, you know, assisting our patients with open enrollment. They also had some money left over from their Navigator grant, I believe. So we've been doing targeted social media ads for, I think, probably the last couple months or month and a half at least. So I haven't seen the analytics yet on those, but like I said, that's been, you know, what we've been kind of doing. Yeah, you know, so kind of, you know, and obviously targeting our patients, right? So when we come through, letting them know about open enrollment, you know, putting messages within my chart and things like that as well. So it's kind of it from El Rio. We talked to, in like NBC, we talked to one of the bilingual stations that actually offer like pre and post roll through like Peacock and whatnot. Unfortunately, it was just a little bit too expensive for, you know, open enrollment. But I learned a lot. But so maybe we'll put it in the budget or something for next year.
Thank you.
Yep.
Does anybody else want
Oh,
to chime
yeah.
in?
Sorry, I can chime in on our end. Yeah, it's gonna sound similar, so I'm not gonna get into the repeat. We do a lot of the same things that Aria does with that. We're creating a couple of social campaigns things. We're not using geofencing for open enrollment per se. We are investigating doing some retargeting ads with geolocators for conversions, which is a little different than geofencing, but we haven't started those yet, so that's probably for next year's open enrollment. As of right now, we created a little teeny video and also some flyers. It's going out in our newsletters and things along those lines. So pretty much the typical outreach. And our community resource team led by Dora at NOAA, they are actually out at a lot of events doing the same things and providing those communication and assets out.
Thank you. Does anybody want to share anything else or anything that's worked particularly well for them?
Nothing earth-shattering. Sorry. Would love Claudia to give you like this amazing thing. But we don't. Noah doesn't have that.
No worries. I will share that we did purchase with Mari Ravago. We will be working with her not only during open enrollment, but post enrollment. Same with Cox Media as a strategy for the PHE unwinding. And with Mari, we are doing Facebook Lives with her on a weekly basis. So it's myself, and I actually have I've had I think Brenda from Adelante volunteered, Brenda Cardenas, and some of our other partners. Lucy, also from Sunset, she volunteered to be a part of these Facebook lives to just talk about open enrollment. And it's a quick 10-minute conversation on Facebook Live with Mari Ravago in Spanish. And she's also helped us broker ads with like 1190, La Tricolor, some of these other radio stations. And I even did a 2-minute segment with Telemundo. That, oh my gosh, 2 minutes. Like, what can you say in 2 minutes, right? That will be shared about Cover AZ. So obviously television is super expensive, but it's also pretty impactful. So we're still employing some of these strategies, and hopefully they drive people to Cover Arizona, and then hopefully to, you know, the health centers as well. So so thank you for letting me share this information with you. And Danelle, I'll make sure that I send you the slides.
Thank you so much, Claudia. Appreciate it.
Yeah.
All right. Like Claudia said, we'll definitely send out the slides. And please follow up with her directly. I'll make sure everybody has her email address if you have any follow-up questions. Michael, Tiffany, do you want to go back to the marketing campaigns conversation?
We can. I mean, it's a nice tight group, so I don't want to take up more people's times if there's not much to kind of chat on. We're at NOAA, we're obviously focusing in a lot on the same things that we always have, but we're trying to make it more more proactive than reactionary. I think in the last 2.5 years with COVID, it's just felt like everything is reactionary in our marketing or communications, whether it's PHE, you know, as our discussion, it's like hurry up and go type of feeling to it. And we're really focusing on trying to launch something that's a little bit more broader, and how we're encompassing all that same messaging, but just on a
brand positioning level. Exciting stuff sounds like it's happening with El Rio and the new website launch, because that's usually a big key to that. I don't know if there's others that are kind of going on. PHE is going to be a big deal for us as well when that unwinds. But I don't think that there's anything earth-shattering that we know for sure we're going to be doing. So there's probably more to share later on what happens with some of our campaigns. I guess that's really where I wanted to kind of see. The other piece that Tiffany brought up earlier in this is, do you guys, because we get this all the time in marketing, it's swag, like gotta have like more stuff for like our patients, our people, our partners, and all of this stuff. And we're really curious about how we manage this. As Tiffany kind of alluded to, do you all, one, have any type of swag store? Do you have if you do, how do you manage that of the ordering of it? Is it on the employee to order their own swag? Does the organization cover the cost of that to some extent? Like, do you use it for gifts as part of recognition? Like, we're trying to build this from the ground up a little bit, because in the past we've always kind of done a t-shirt campaign and a little bit of swag here and there, but like not much. But man, we constantly get questions about this and wanting more and more. And I don't know how you all are dealing with that, or even how you're responding to those requests, because shockingly it costs money, right?
So, Michael, I can jump in unless someone else has something they have. But so I'll kind of two different tracks here, right? So when I hear swag, right, with events and stuff, people want water bottles and they want branded El Rio or branded stuff. So I've gotten to the point to where I only house El Rio pens and a general information sheet that has a map of all of our locations and our services. So sometimes we order, we'll order clear water bottles or something like that. Typically they're given out through our like health builders program, like for participants and whatnot. And I find whenever I end up ordering, 500 extra of those or something, someone comes out of the woodwork and it's like, I heard you have water bottles, right? I don't know where they're hearing it from, but yeah, they come up from the depths and they're like, do you have water bottles? And I'm like, wow, I just got these. How did you know? Right. And then they get used. So, from a swag, like for giveaways, I've simplified it just to pins and info sheets. Obviously, badges and backpacks, things like that. We'll get, a slap bracelet ruler that will throw an El Rio logo on or something like that. But those are really kind of event specific. And then as far as swag for like employees, so really we partnered with Arizona Uniform. So we offer, we've got full on scrubs, tops, bottoms, jackets, and we charge a flat rate of $15 per item. And that is a payroll deduct through our employees. So they can go in anytime to that site. They can order those materials, and then it's up to 2 payroll deductions. So if they order one piece for $15, they can choose to either have it on their 1 payroll or 2 payroll, but they can only go to a max of 2 payrolls. So if they buy $100 worth of stuff, they can split it between 2 payrolls. And then we also have El Rio t-shirts that are available on there for $7.50 each. And then during special campaigns like Teal Tuesdays for ovarian cancer, the breast cancer back in October, we'll put up specialty shirts that are designed either by employees or I ended up designing them. And then we sell those for $7.50 as well. And then El Rio subsidizes that, right? So the shirts, depending on the amount, like the smaller ones, like the smaller campaigns, like the Teal Tuesdays, I think El Rio, I think we end up getting the shirts for like $8.30. So El Rio will subsidize the difference. And then for our, I think their Cherokee lines of our scrubs, they're anywhere from like $19 to about $23 based on extended sizes. And El Rio subsidizes that cost as well. So it's just a flat cost for employees. it was the cheap way of trying to get all of our employees branded and wear logo wear without enforcing them and without El Rio picking up the full bill.
I like that idea. I mean, right now we most of our employees when they start, they get a set number of scrubs. Like we pay for it full on, and then they can reorder after a year's time. You know, at their anniversary year to order a couple more as part of wear and all that stuff. But man, I love the idea of like a little bit of skin in the game too, though. Man, like it's fine.
Right.
I love the idea of like subsidizing to the point, but knowing that it's not free. So they know that there's some level of cost to that.
Yeah. Yeah. So we launched that program, looks like September of 2019. And I just keep track of orders, but you know, most orders are multiple pieces. So it looks like we've had about 1,300 orders in over the last, you know, couple years. But then, you know, I'd mentioned with the Teal Tuesday shirts, that was available for 2 weeks. We had 224 orders of that. And then for our breast cancer shirts, we had about 350 orders. Now, those could be multiple orders. I'm just keeping track of, you know, order counts. So,
Okay.
but I mean, it's been fairly successful. I mean, you know, my wife's a nurse, and obviously she's always like, "Can I order?" I'm like, "Well, they're El Rio purple," or you know, like, you know, because she'll go out and you know, a good set of scrubs, you know, can cost you, you know, upwards of $100 something. So, yeah, you know, and they're like I said, they're a nice line of Cherokee. You know, we actually brought in different lines and had a focus group kind of try on different ones and model them and all that good stuff to, you know, see what they were most comfortable in. And then, you know, we went ahead and implemented, you know, those particular lines. And, you know, they're branded. They've got the El Rio Health logo or Health On logo. And yeah, like you said, it's nice because there is skin in the game. The employee's paying for it. You know, but on the flip side, they're still getting very nice scrubs for, you know, a huge discount. You know, if you can get a set of top and bottoms for $30, you know, the only thing we ran into, and it's just what happens is, you know, they can order them right when they start Neo. And if they don't make it past their 90-day or they go to order and they leave the organization, if it doesn't, it'll still try to hit their payroll, but there's a gray area there where sometimes, you know, they'll order it and like they'll get their last paycheck and, you know, we'll have to cover that cost. But I mean, that's few and far between. And then we did have an opportunity for employees to come to our corporate office and try stuff on because all sales were final. Like we don't do returns or, you know, because the goal is we don't want to manage a store per se. We let our vendor do that. So, but, you know, after 2 years, we had maybe 4 or 5 people come to try them on. So I mean, I think in the 2 years in the year or 6 months now that we haven't had the ability to try on, we've had one employee order the wrong size and they ended up just selling it to a coworker and ended up, you know, for $5 or whatever and ordering a new set or whatever. So, you know, we haven't really run into any issues, you know, or any pain points that's really kind of back ordering just because of the supplier. I mean, that's a problem, but the nice thing is the vendor doesn't charge, or El Rio doesn't charge the employee until they've actually shipped the item. So, you know, we don't have an employee getting charged for a pair of scrubs that they don't get for a month because they're on back order. So that's kind of helped a little bit. And then I'm trying to think of anything else. They ship twice a month. So if an employee orders it before the 15th of the month, they'll get it at the beginning of the next month. They'll get it on the end of the month shipment. And if they order it after the 15th, up until the 30th, they'll get it on the 15th of the next month.
Do you all ship direct to their homes, or do you ship to a site that then they can go pick up at?
We ship to our corporate office, and then our shipping and receiving, you know, we run stuff every day to our different health centers, and they just put it in that.
Got it.
Transportation, yeah, it takes care of it. So because we looked at home shipping and the AZ uniform, they only use FedEx. So home shipping was like their minimum was like a $17 charge, which at that point, you know, negates the cost savings with the pieces.
Yeah, we had the exact same problem. So we do our shipments to the clinics because we could set up and build that into it for the uniforms because there's no way we can ship.
Yeah. And we have a manager is responsible for signing for those. So there's only one point person versus, just the front desk person or something. So that way, there's not an employee signing for someone's, clothes and then the box ends up, in storage or something like that. And no one knows where it is. So we tried to be as proactive as possible before we started the program. And like I said, we've had a few hiccups, but for the most part, it's been, like I said, almost over 2 years now, and it's been running well. Or 3 years now, actually. I guess 19. Yeah. Sorry. I'm with COVID. I'm a year behind.
Yeah. Aren't we all? So what does Mountain Park do? Do you guys have this issue? Nope. Okay. All right. Well, it's now just Noah and El Rio again. I think Nathan, like I mean, we could just set up a time we can talk, next week or whatever.
Yeah.
I didn't want to take up anybody else's kind of time with it. The rest of these guys have to hear me talk every day, it seems like. So
No.
I will if it's all right to know, I think we can just didn't have a lot of participation. We can kind of wrap this up. But Nathan, was there anything else that you wanted to kind of ask the group, since you have like my team?
No, I mean, I'm looking forward to our conversation, and yeah, like next week, or with it being a short week, even the week after. But I'll reach out to you, and then we can just throw some times out there and see what works best for the both of us. And but yeah, I think that's all I have. I mean, kind of answering. I didn't really chime in with what's El Rio have on board for 2023 marketing wise, because like you said, and Michael, I think you hit the nail on the head. I feel like it's been such reactive, and I'm almost waiting for the next variant to come through and like shut everything back down again, right? And I hate to be like that, but I mean, that's the world we've lived in now for the last 3 years or 2.5 or whatever it's been. So we have a new CEO, so I mean, that's interesting. The Clinton Kuntz came over from Marana Health, and Marana Health, smaller health center than El Rio. Their marketing efforts, right, drive patients through the door and things like that. So I've had some interesting conversations with him and around the wait list, and yeah, what do we do? We have working on a strategic marketing plan for 2023, and it's weird to work on something that says strategic in it and marketing, and not really be driven around driving patients through the door. So I've got my work cut out for me with that. But I think just patient engagement, with the switch over to Epic and stuff. How do we really leverage my chart? I know I got to get back to Brooke about what do we do, if we've got patients that are scheduled or they're a month out, and we have openings that day or the next day. So I think we're still, as an organization, really just trying to figure out how to make Epic as efficient as possible, and get that wait list down and get patients seen, but also I think a lot of my recruiting or a lot of my marketing efforts will be helping with recruiting next year, positions and stuff, providers. So it can still be strategic, but it'll be more for growth and retention of employees versus patients.
Yeah, that's gonna be us too. I'll talk to you more about it kind of when we schedule our thing, but staff recruitment is a huge deal with us. We're maybe a third of the size of you guys, actually probably a little less than that, and we have 100 openings right now. That does not include providers.
Wow. Yeah. We just had our first on-site job fair since pre-COVID, and we did radio, and we did social, and we did a bunch of stuff, and I mean, it was successful, but yeah, it's just, I'm at the point now where, and obviously, there's Tucson's a fairly large market, but I'm like, at what point have we oversaturated and people just aren't out there, right? Like, are we spinning our wheels, or, and I hate to think like that, but yeah, where, how much more can we put efforts towards things, and to your point, see, just not really moving the needle at all.
Yeah.
That's where I think our struggles are. Yeah, we've got, I think we're over almost 1,800 employees now.
Yeah, we're catching up to about 500. So, but yeah, it's for the, provider recruitment has been really difficult too on us, and they go in waves to us, but yeah, it's just that overall retention and the burnout has been, it's not necessarily providers are leaving, but they're cutting hours. They're like, oh, we want to do, 0.6 FTE. We don't want to leave, but we just need a break, which is understandable.
No, I've seen a lot of that because I get, for our NEO and stuff like that, I get an email notification, and anytime, provider cuts back or moves locations or something like that, I get an email. And it was like, it seems like, to your point, like these last couple months, we've actually had some providers leaving, but even cutting down their hours substantially, right? So I don't know what that trend is or what that's telling, but I don't know if it's COVID burnout or if it's, just, I don't know. It's,
Speaking of NEO, are you in charge of your NEO, or do you play a role in NEO, or you just get the updates?
I just get the updates. Yeah. It's, it's interesting. And I mean, it makes sense for an organization of our size, but at the same time, like, as you can probably tell by some of our conversations, I'm pretty siloed in some of the stuff that goes on, like, as far as, patient communications and NEO, and even like, provider recruitment, that's specifically handled directly through our chief clinical officer's kind of staff, and not even through our HR. So there's some separation there as well.
Oh, okay.
Which is kind of interesting. And in my mind, I would think that would all kind of funnel through HR, but yeah, so I, other than making sure that, the welcome video is updated with like our latest map of locations and stuff for NEO, and, that they're promoting the apparel program and whatnot. I mean, that's the extent of my involvement with NEO.
Okay. Well, great. And Nate, did you have anything else? I mean, we're obviously wrapping this up pretty quick.
Yeah. No, I mean, I think that we're good. It's interesting because, we talked with Clint, our new CEO, and, he talked about obviously strategic marketing plan for 2023. And, I kind of took us back to when we had that conversation about like a social media plan as well, right? Because Rio is completely organic. Like, we throw stuff at the wall, we see what sticks, anything exciting we put, but there isn't a true plan behind it of, we're going to talk about we're going to highlight a service, or we're going to highlight a provider, or, there's really no plan. But with the new CEO, Clint's asked me to put something together. So obviously we keep the lines of communication open, Michael, and I know, you were kind of leading that conversation about, kind of around social media and things like that. So I would love to kind of pick your brain as we move forward, or I work on that plan, just to kind of see what are your basics, what's your foundation, we need to do this or that, every week or bi-weekly or every month on our social media. And like I said, it really isn't, I know your plan might be for, an acquisition, but, mine would be more along the lines of, retention, things like that, or even, employment, stuff like that.
Yeah. Actually, we'd be more in line with what you think. So we'll chat. Yeah.
Okay, cool. Perfect.
Cool. Well, Janelle, I think
done.
we're good.
All right. Before everybody leaves, I just have to show a picture of my cute baby.
Oh.
We just had Christmas pictures done, so I'm just like obsessed with them. So any chance I get to put it on the screen, I do.
That's awesome.
Anyway, he had pictures done at school, and they're awful. They look like mugshots. I was like, this is the best that you guys got. So I'm glad we got good Christmas photos at least.
Yeah,
that's awesome.
Getting that age where Christmas is going to start being really fun. So
I know.
Yeah. I miss those days. Mine's 12 and 9, and it's like electronics, gift cards, or money. That's the extent of.
Yeah, this is he's crawling now and almost walking, so it's exhausting.
Yeah,
but fun.
Yeah, enjoy it because it goes faster than you think.
Thanks. Thanks. Yeah, that's what everybody says. All right. Well, happy Thanksgiving, everyone. I hope everybody has a good holiday. And even though it was a small but mighty group in terms of the number of health centers, I felt like the discussion was very robust. So I hope everybody found it meaningful.
Likewise. Yeah. And Michael, I'll reach out to you. And then Brooke, it looks like you're still on. So I'll get you some answers around, what do we do when we have same day openings?
Yeah, that'd be great. And like Michael said earlier, anything you guys learn from the transition to Epic Ocean, please think of us and help us out to eliminate some barriers.
Well,
Yeah.
Brooke, they actually have their own instance of Epic. They're way bigger than us. They're like special. Yeah.
Oh, I'm jealous.
But regardless, there's a lot of lessons learned in that transition, right? So I'd love to still pick his brain.
Yeah. I'll answer what I can. I mean, as far as, I was mostly just a support role and, making sure our patients were aware of the change and, getting them signed up and stuff. And, when we launched and, we kind of followed their kind of recommendations, make it fun, right? Like, balloons and, we kind of did all the health center specific type stuff on launch day. But yeah, I think, definitely be happy to share. I can't think of anything off the top of my head of like, I wish we wouldn't have done that, or even I wish we would have, and I'll get enrollment numbers as well. So that way I can, let you guys know where we're at as far as how many people have actually signed up for my chart and that way we can.
Yeah, I'd love to hear about your percentage of patients that are active, but also utilizing it, because it's still, I'm a huge advocate of it from the patient experience point of view and from internally with employees and reducing workflows and obstacles. So it's something that I think we still have opportunity with here at NOAA.
Yeah, I was just, it's funny. I did a presentation for Nancy back in September, right before she left for Epic. Just while I've got you on the phone, let me see if I can bring it up real quick and just kind of go through, because she had to present. Let's see. Give you the high level here at the end. We have like our mini Z scores. Looks like our 2022 goal, and this was back in, like I said, Q1 and Q2 numbers. So for online appointment scheduled, our goal was 15% for the year. At the time for first quarter and second quarter, we were sitting right around 10%. And then patients with my chart, our 2022 goal is 60%. So through Q2, so this obviously was just the first two quarters, we're at 51% of our goal of our 51%. So we're 9% away of our 60% goal.
Is that accounts or is that actual true engagement, Nathan?
Well, I don't know. I'll have to find out. But yeah, because right. Is it somebody who just signed up one time, or is it people that are actually utilizing my chart and, messaging and things like that? So, let's see, key success factors. Just trying to see if it gives the definition of, what enrollment is, or patients with my chart.
Well, I mean, I'll be honest with you, either way, like to have that at 51% of your 150,000 patients, like I call that a pretty good win.
Yeah. I mean, like I said, we've been,
that sounds really good.
Yeah, we've been pretty happy with, the adoption and stuff. Because looking at, actually, I wonder, if you guys have a couple more minutes, let me see if I can share this. Because like I said, this was a presentation I did for Nancy, but
yeah,
let's see. Oh, only meeting organizers and presenters can share.
I just made you a presenter.
Got it. All right, cool. Can everybody see? Oh, there we go.
Yep.
So this is really just kind of a high level overview of our implementation that Nancy put together for Epic. But let me So this just talks about that. Sorry, I'm kind of going through quick because I don't want to bore you guys, but here was like our journey to transformation go live. So these are kind of like maybe internal best practices that we kind of did. And I can, well, Nancy's no longer here, but I can check with Clint. I mean, I don't think there's anything secretive here, but I'd be more than happy to share it with you guys.
Good.
Yeah.
Mind.
Yeah.
Yeah, just see if you guys implemented or tried anything different than we have. So yeah, if you could share that, that would be wonderful.
Okay. Yeah. Kind of highlight like our key success factors, mini Z scores. And then here's, like I said, and I'll get that definition of patients with my chart. Like, you know, it's interesting though. It looks like the online appointment schedule, well, appointments though can drop, you know, it looks like first quarter is 10% and then 8%. So you know, we'll have an aggregate obviously by the end of the year. What would we do differently? So here we go. So complementing the characteristics of who make the best workflow leaders, communication across teams, super high level there. I mean, we could drill down if I need to. On-site Epic at the elbow, more customized education training for FHQs. Because remember, we did our implementation too during COVID. So a lot of times you know, their Epic was supposed to be on site. And obviously they weren't doing a lot of that due to COVID. So
yeah.
So I think that was probably, you know, I would say a pain point, but definitely different than when you have the trainers on site. Workforce recruitment challenges. Oh, sorry, go ahead.
No, that's okay. This might be totally out of your area, but just curious if you have any insight or connections to how your staff is managing those in-basket messages and what that workflow looks like. Because I know we definitely struggle with that and the turnaround time getting back to patients, and who wants to own that sometimes. And obviously that's a patient satisfier for responding within 24 to 48 hours. But if it's just sitting there, that's not good.
Yeah. And definitely outside of my area, but I will add that to my list of questions.
Thank you. I appreciate that.
Yeah, for sure. So future opportunities.
Yeah.
Yeah. Like I said, I will, like I said, I don't think there's anything secretive here, so I can share this.
That would be wonderful.
Okay.
Yeah, we have this weird dynamic because we're on Epic right now, so that we don't have quite the same difficulties, but the instance is going to be changing. And then the thing that's going to be super confusing to our patients is they're like, well, we already have my chart because it's my chart through the hospital. And they're like, no, it's a different my chart you have to sign up for. So I am worried about that. And Brooke and I have been chatting a little bit about how we're going to do that, because it's going to be, it's the same words, but they're different. Like it'd be one thing if it was like completely different, you know, portal, and you're like, no, we're not on that portal anymore. It's like, no, we're on my chart, but not that my chart.
Yeah, so a little struggle there. And then another question that just came up, and obviously I just kind of helped on this, but with referrals, like we changed over from Crimson to Epic, and now, you know, it's like El Rio Connect, right? So I know we had some pain points for referring out to like specialties and stuff like that. So, but I can definitely, if you guys have questions, you can send them to me, or I can connect you with someone on our team that kind of handled all that. And I know for sure, you know, there were pain points and things we wish we'd done differently as far as getting that messaging out to, you know, all of our connected, external specialty providers and you know, organizations.
Yeah, we got to do that too.
Yeah, Michael, I was like, please, maybe getting Dr. Rosas and Cheryl and Patricia on the call about referrals, because referrals is another pain point that we've been struggling with for years in our organization. And we're starting to make some headway, but that is, yeah, anything you guys can help with that, please, because yeah.
Yeah, I mean, we did, typical, right? We went through our list. We, sent email communications. We sent letters. We sent, all kinds of different things. And we still, I mean, to this day, I just got added on an email thread the other day where, someone had faxed, a referral to somewhere, and it's somewhere got lost in our, the world of El Rio fax world for a referral, and, the patient wasn't followed up with. And, so I mean, and like I said, we launched last November, so that was a year ago, and there's still organizations out there that weren't aware of El Rio Connect and Crimson and all that change. So yeah, there's always, I think, slip through the cracks, right?
Well, this has been great connecting, and I look forward to collaborating with you guys in the future. So thank you.
Yeah, and I'll work on those questions for you, Brooke. And then Michael, I'll just connect with you offline via email, and we'll look at sometime maybe next week or even the week after, just because of the holiday.
That sounds great. That'd be wonderful. All right, Jenny, it looks like you jumped back on just for us so that we can jump off.
Really quick, just I know you had asked, and it was literally right when I was like, I'd press like.
I know.
We have a system that we have on our intranet that anyone can order apparel, and we actually pay half of it. So folks end up paying about $7 for a t-shirt. Right now the little jackets are really popular, but it was all stuff that we've approved, and then folks go in there and order it, and then it gets delivered to their clinics. So not to home, but to their clinics. Yeah,
that's kind of what we're doing too. We just got to figure out. And do you have it with the intranet? Do you have a vendor that's just doing it so they can order it themselves, or do they put in a request and you all have to order it?
Yeah, no, it's on, like, we worked on the back end to get the page going, but then they just go in and order it themselves. So there's a little bit of like, oh, I never got my shirt, or what, like every once in a while, but it's way better than before. And this year, for some reason, a lot of people use it.
Okay.
And so same thing. It's kind of like we're paying a little bit of money, but now we have our branded stuff. People are wearing it.
Yeah. Okay. That's good to know. What vendor do you use local for the for your swag stuff?
I believe it's Great Impact. Let me get in there, because I think just by seeing it, I'll know.
And it's their site too, so you didn't have to build it out. You just kind of linked to their.
Yeah. Hold on.
And real quick, while you're looking for that, there's one thing I did forget. So I know we'd also asked about like giveaways. So we do print a certificate, like for MA week, if like a manager wants to give their MA like a $15 voucher. So the only thing, it's a little cumbersome, like I have to basically get that list of the employees that certificate was given to. I give it to the vendor, and they apply the credit onto that person's account. So but it works, but it's not as smooth as I wish it was.
Okay. And that, because each of your employees have to create their own account into your swag when they order it, that's the way they can do it?
They do it that way. They can do it manually, or when we get like Neo, I send the vendor the list of our new employees, and they kind of pre-set up an account. So once that person comes through, it connects basically. So they know like John Smith is, and then that way too, what that allows me to do is go back and see what percentage of our employees have at least activated an account and or ordered.
That makes sense. Now you can actually see engagement with that. Okay.
Yeah. So sorry, I didn't mean to jump in there, Janae. I just forgot that piece.
Well, wonderful. Wow, we just used up that whole entire time. Great job, everybody. I didn't think we'd make it, but we got to the end of our discussion, and it was really nice to have just a few of us on to have that discussion. Was there anything else that anybody else needed to share? Any updates, any announcements? I think the only other thing we need to talk about maybe is the next meeting to know.
Yeah, the next meeting is scheduled for February 24th. It is the 3-hour block, 10:30 to 1:30, and it is supposed to be at Mariposa.
Okay.
which will obviously require travel. So I'm gonna put together a registration for that one so people can indicate if they're going to be in person. Based on how this meeting went, I just don't know if we're going to have good enough in-person attendance to make it worth it. And I say that and you all may have different opinions about that, but I just feel like hybrid meetings can be really challenging. So if there's not going to be that many people in person, I just feel like it's better to just do it virtually. Because I feel like when things are hybrid, not everybody can hear and you just run into some challenges. So anyway, it's supposed to be at Mariposa. We'll see how that goes. We had our behavioral health committee meeting this week that was supposed to be in Sierra Vista, and 2 people showed up, including an Alliance staff person. So that's what we want to avoid. So we'll see how many people are registered to be in person and go from there.
That sounds good. I think we need to be flexible with that. And my guess is, yeah, we will figure it out. Okay. Well, that sounds great. Thank you all for coming on, participating. Look forward to chatting again with you guys in February. Nathan will chat later next week. If there's anything else that comes through the channel and we want to open up to some further discussion or any ideas, especially for February, we're all open to hear any other topics or ideas that we'll chat with. So, all right.
And yeah, it's great impact.
Yes, great impact. Okay, I wrote it down and I was checking their site out after you said it. So, okay. Great. Thank you.
Thanks everybody.
all.
Bye.
Have a nice weekend.
Thank you, everyone. Have a great Thanksgiving.
You too.
See ya.
Bye.
Bye-bye.